In Chapter 12, Assessment of Language Disorders in School-Age Children, we are going to discuss how to assess this population. Let's get started. Once the child enters school, services are offered through the school if the child meets eligibility criteria. We will talk more about this in just a minute. As the child gets older and more self-aware of their difficulties, he can participate in the decision making. When the student is older, they might want to attend the annual meetings at the school, which are called ARD meetings, admission, review, and dismissal, in which the team looks at progress and sets goals for the next year. It is an important step to get the children to understand why they are receiving services and to understand their difficulties, and then support them to be self-advocates. In schools, the SLP must follow the mandates of IDEA or the IDEA law or the Individuals with Disabilities Act. Outside of the schools, a clinician does not have to follow the IDEA mandates. The eligibility criteria for services within the school changes. The reason why one assesses and intervenes is different in the schools than in a medical setting. There's a change in focus in the schools. The school SLP is assessing to see if the child has the skills to achieve academically. So the child has to have a disorder in communication as well as an academic need. He has to meet both of those eligibility criteria. So assessment is really going to focus on the language skills needed for comprehension and expression, but also to succeed academically in the areas of reading, writing, and spelling. There are multiple professionals who work in the schools. There are the SLPs and the audiologists, of course, but also school psychologists or counselors, the diagnostician, the physical therapist, occupational therapist, behavior analyst, and reading specialists, and the resource teachers. The team should work together, and they usually do. The school is usually a great team environment, so they work together to support the child. A student is referred for the first time when he has difficulty in the classroom. Remember, the child would have first gone through the response to intervention or the RTI process and not made good progress with the first levels of support. There is plenty of evidence of how the child is struggling academically through that process, but now it's time to assess and really understand the deficits to help explain why he's struggling. After the child has the initial assessment and is receiving special education services, IDEA requires a reevaluation every 3 years to requalify for services in the schools. Within the assessment, what answers is the SLP trying to find out? First, we would love if the child is within normal limits, right? But if not, what is the level? Delayed, disordered, or is there just a difference? Next, we determine the etiology through the assessment. The team is going to find out how the child's brain works. How does the child learn? Then, how does this etiology impact the child's academic performance? It is important that the teacher and the parents really understand the child's characteristics related to this etiology. You know, is the child not being defiant when he does not follow all 3 directions, or necessarily has the ability to attend to the lecture for 20 minutes while sitting nicely in his chair? You know, what's going on? Is he being a behavior problem, and just doesn't want to attend, or is there a true etiology that's causing that behavior? Next, the results from the assessment will allow the team to make recommendations. What are the classroom accommodations that will support the child's learning? Do we need to give him less math problems or have the child sit at the front of the room? Those kind of things. Then, what specific therapy intervention is needed to evoke change in skills And then if there are any referrals to other professionals within the school team um, that we haven't brought in yet. The team might also find difficulties that are outside of the scope of the school focus, and they need to refer to outside professionals because maybe they see some areas that are outside of the academic need, but they do need to be addressed. So this could include an ENT if they see some voice issues that they feel like there's an etiology that needs to be addressed, or maybe uh, dentist if there is a structural problem, things like that. Lastly, if the child has deficits which warrant intervention through the schools, goals will be set. So terminal goals, such as what does the child need for graduation and what does the child need after graduation, will be specified. Transition planning for after graduation begins when the child is 14 in the schools. We'll learn a little bit more in the intervention section of how long that they can be in services in the schools, but I'll give you a little heads up. It's through 22. So kind of think about 14 to 22 is a long time, but I'll kind of explain why that long transition time is so important. So the team is always going to keep the end goals in sight to make sure their short-term goals are holistically focused to help the child meet those long-term or terminal goals. Then the team will set the specific goals to help the child reach those long-term goals. In Texas, we have the Texas Language Eligibility Template. To assist with determining if a child is eligible for services, these 3 questions will be answered by the team through the evaluation or the assessment. First, does the child have a language disorder? Second, does the disorder impact the child's education? And third, does the disorder require the services of a speech-language pathologist? So the child might qualify for special education services, but the team might determine that SLP is not the best person to address these problems in the schools. If it is a higher level language issue that is very specific to academic content, then maybe the special education resource teacher might be a better support than the SLP for the child. So here are the assessment components. These should not look much different than the process for earlier ages. The biggest difference is that we now begin interviewing the student on his perceptions of the difficulties, as well as the teacher and the parent and caregivers. Excuse me. First, we will screen any areas that we want to make sure that are within normal limits, but might not need a full battery to determine if this. So maybe we just choose to do a screening, or we might initially screen, of course, and then decide, hey, we need further testing. So sometimes screening just includes looking at the skill during the language sample and determining if there are any red flags, or sometimes we might do a more formal screener. Next, we are going to do a full case history to look at the medical, developmental, and the family history, and then any previous testing, intervention, and then what are the primary current concerns. For the next areas of the interview, the language sampling, norm reference, and criterion reference assessments, we're going to talk about these in more detail in the next slides. So what I'm going to do in this next part of the PowerPoint is refer to sections of a report of a student that a student myself wrote on a client who came in for an evaluation in the clinic. So I'm hoping that by looking at this report and you guys reading through the report, it's going to help tie all of this together. It's also going to give you examples within context. So I could sit here and list in the PowerPoint all of the different norm reference and criterion referenced assessments that you can give in a certain area. But at this level, you don't have enough training to do it, nor is it in your scope of practice at the undergraduate level to do assessments. So, I really want you just to see some of the different assessments. And then when you get into graduate school, you will definitely learn and have a lot of practice with all the different specific assessment measures. But then this way you can really kind of see, a client, you learn a little bit about them, and then what test did we pull in. So I am going to tell you periodically to stop the video and go to the report and read a certain section of the report. So what is nice about the school age is that we now can get an idea of the student's perspective on their difficulties. When they're little, they don't really have much self-awareness, nor do they really have the language abilities to describe what they're thinking and what they're feeling. But at the school age, yeah. So we're going to really look at what is the child's self-awareness, what are his perceptions on what is hard, not hard, and the most important is why is it hard or not hard? Is the student motivated to participate in therapy, or does he really not care? I mean, some kids school age don't care about their differences, or they're so aware of them that they don't want to be signaled out from their peers to go to therapy. Or maybe some care but don't want to miss PE to go to speech therapy. So these are all dynamics that we need to understand, right? And so being able to get their perception is really going to enable us to be more efficient and effective in our therapy planning. They can also give us great insight on their learning styles. I can make observations of their behaviors and how they react to my teaching, but their feedback is invaluable in the process of choosing the most effective and efficient procedures in remediation. This is the same with the learning environment. The student can tell me exactly what in the classroom makes it hard to learn or what helps him. If I know the student's personal goals, I can plan intervention that will hopefully be motivating to him and help him see how the therapy is going to benefit him in reaching those goals. That is that step when you get to someone who has some metacognition, so the ability to understand their differences, how that affects them, then this step of them being part of this planning, it really helps with the motivation. So this interview time is the best time to assess their metalinguistic skills. So what is their self-awareness of their language, what they have and what they're lacking? How then does this affect their ability to communicate and interact with others? Can they talk about language, its rules, and how they function personally within those rules? I can also look at their metacognitive skills. So what is their level of problem solving as well as self-regulation? So a language test might tell me that they are really good. And then when I talk to them, and then we'll talk about observation here in a minute, I can maybe see very quickly that they can talk the talk, but they can't walk the walk. So a lot of times that self-regulation is the culprit. During the teacher interviews, I'm looking for strengths and weaknesses that the teacher observes in the classroom in the areas of receptive expressive language, pragmatics, of course, so how do they use those language skills, their executive functioning, so how does the student organize, problem solve, react to classroom situations, and then, of course, their strengths and weaknesses in reading and writing. And then lastly are the parents. I'm going to look at the same areas as the teacher, but of course, how does the child, how do they function in the home in their everyday environments? Now I want you to stop the video and I want you to read the history section of the report. This will be an introduction to the client, so you have some background on him, and it'll help make a little bit more sense of why we chose the battery of tests that we did. And then also I've included, or of course we included some of the interview from the client in the history section. So that's typically where you're going to put interview information, but sometimes it can go in the body of the report also. Just kind of you bring it in as it's appropriate. The conversation sample, this is our next part, allows for observation assessment of skills in a more naturalistic situation. So the environment depends on what you're going to analyze for. If I'm wanting to see how multiple partners or certain partners like peers, or look to how the child uses his language, then I might want to observe in the classroom versus just a one-on-one conversation sample elicitation that you've learned a lot about in our classes. But what's great about in the schools versus a clinic situation is that the school therapist does have access to more naturalistic and to peers. So it's great. So depending on the assessment question, we're going to analyze and look at narrative abilities in the conversation or language sample. And then, of course, we're going to look at the language abilities. I'm going to look at content. I'm going to look at form. And then, of course, use is a great one to use the conversation sample for. Just a quick reminder that the sample should really contain 100 utterances ultimately, but if we can't get 100, our time is limited, or they're not talking, just remember that we want at least 50 utterances to be able to really, that's more for the, if we're analyzing for the language part, narratives is a little bit different. Okay, sorry for the pause there. So now I want you to get your book out and turn to page 483. And we're going to look at table 12-1. So pause the video now to get the table in front of you so we can discuss this. Okay, so hopefully you're back. You will see that this table gives suggestions for conversation and language sampling activities, what to assess for, and then helpful resources for infants to adults. So go to the next page, 484, and we're going to look at suggestions for the elementary age and the junior high and high school ages. All right, so for the school age children, so they're saying 6 to 12 years of age, they give some different ideas of how we are going to elicit language from them. So the first one, of course, is prompts for personal narratives, fictional stories, scripts. So giving them a picture and say, hey, make up a story. Or you can just say, just give them a prompt without a picture and say, make up a story about something that's not real and see what they do. Then, of course, we can just ask them questions, right? Interview questions. So what can you tell me about your family? Tell me about your school. Tell me about what you like to do when you're not in school, or tell me about some different hobbies. They are reminding us that for older children who can write, we want to get both written samples and oral samples. So that is definitely a difference at this age. With the younger ones, we were just trying to get oral samples, right? So it's best if we can collect samples of classroom discourse from both ends of formal to the very informal continuum. So I want to ask you, what is missing here? that we maybe a way that we elicited language before from younger ones. What do you think? Okay, it's not referencing play, right? Bringing different toys in and things like that. Now, I will say, maybe that 6 to 10, kind of depending on their cognitive, their interests, things like that. I might bring some toys in. So you'll see in the report, um, we did have just some action figures and things like that for this child because we knew that was an interest of his. But, but he didn't sit there and symbolically play just tons, uh, with the toys as much as the younger ones would. So what are we going to look for from these 6 to 12-year-olds? So in the narratives, when I ask them to tell us about something, we're going to look at narrative structure or discourse structure. So we're going to go into narratives in pretty great detail next week. So you'll learn about what is the overall structure that we're looking for. And then use of later developing syntax forms, post modification of nouns, coordinate conjunctions, adverbial, blah, blah, blah. We're going to really just look at syntax and grammar because we should really have all of that down that we should. But this is a huge age for finding breakdowns in that. And then we're going to look for some pragmatic things. What are some repair strategies? When they have communication breakdowns, how do they relate to me as an individual? Or if I have the opportunity to observe in the classroom or with peers, that's even better, right? So now let's look at the older, so the adolescents, so in junior high and then in high school. So using activities, so to elicit the sampling activities, use activities that require story creation or retelling either without or with a visual support. And we're going to collect a sample of the expository discourse, so telling of those stories. Do they have a nice beginning, middle, and end? And then elicit samples of both oral and written discourse again. And then use written materials to prompt conversation. So maybe give them something fairly short from a magazine or a newspaper to read. And then discuss it. So that is one of my favorites because it's really looking at their reading comprehension and then their ability to take a newly learned topic and how flexible are they with that language and asking and having a conversation about that with me. And that might be a little too high for those school age. I'm definitely going to bring this in the older adolescents. So what are we going to look for? We're going to look for all the same stuff that we looked for before, but we're really, really going to look for perspective taking, some theory of mind in this older group. Definitely cohesion and structure of their conversation as well as their discourse and narratives is important. And then definitely comparison of cohesion and samples in which information is shared versus not shared with the audience. So again, understanding even at a higher level their communication partners' needs and do they know the amount of information, the quality of information that they need to give that partner. Okay, so now what I want you to do is stop the PowerPoint and I want you to read the first paragraph of the language sample or the first paragraph under language, all right? And this is where I'm talking about the language sample. We commented on relevant highlights of the conversation sample that we took. So notice that we did not analyze for anything, off of that sample, but we definitely made some observations. For the specific assessment battery, we're going to be on this one for a little while. The SLP is going to have a combination of criterion referenced and norm reference assessments based on those skills that we're looking at. There are a lot of ways in which criterion reference assessments can be used in the language assessment battery. You can see that this is a pretty long list here, right? So I've included the conversational sample again because I want to reinforce that any analysis that you do on a conversation sample will be a criterion reference assessment, okay? So I want you to as many times as that you can see things categorized as criterion and norm reference, I think is important here at the beginning of your learning. We will often get personal narratives or recounts in the conversation sample, but as we're going to learn next week, there are very specific narrative analysis that we can conduct that give us valuable information. So we'll learn those specifics on obtaining and analyzing narratives next week. We can observe and then complete classroom communication checklists. So these are often completed by the teacher, or they can be completed by the SLP. With the teacher, what are the areas of difficulty that he or she sees in the classroom? As an SLP, I can complete a checklist looking for any area of language that might be in deficit, but this is also a great way to look at pragmatics and how the child is using his language, of course. And then the portfolio assessment is a procedure in which we get pieces of the student's work over time and from different environments. So for example, if we were looking at language abilities and writing, we could collect samples over time across different subjects to get an idea of the student's everyday functioning in writing. So this is definitely a collaborative team effort. So the assessment team is usually going to decide what skills do they want to assess via the portfolio assessment, and the team will decide which are the best samples of their work throughout the curriculum that will give a broad and holistic view of their everyday functioning. Next, we can observe in the classroom or different school environments, like we've already discussed, and analyze what is observed based on the skill under assessment. And then lastly, for criterion reference assessments, the SLP can administer language-specific criterion reference assessments to look at specific language skills. So for example, in phonology, we might do some naming tasks, or RAN is for rapid automatic naming. Or we might look at the student's ability to produce multi-syllabic words. So there are 3 million criterion reference assessments that we can pull in. And then we also just make them ourselves based on what we're wanting to look. So again, that criterion reference assessment, taking you back to your clinical methods class, is ones that we just compare to a standard, right? And so do they do this or not do this based on our knowledge of either development or what skills are needed to carry out a task? So in semantics, a good criterion reference assessment could look at a specific school vocabulary or set of vocabulary that might be deficient, or assess the overall lexical diversity. And then for syntax and morphology, the SLP could make a criterion reference assessment to look at specific morphological markers. So maybe plural s, or grammatical structures, noun or verb phrase structures. So this is just me making a list of different stimulus items for either that plural s and directly eliciting that from them is an example. So next, for norm referenced assessments, the SLP is going to choose the norm reference assessment that will best assess the areas that are in question, whether it be in language, reading, or writing. I mentioned cross battery here. So the use of cross battery assessments is very common in the school age population. This is when the SLP uses different portions of the norm reference assessment to answer the assessment question. So by school age, a child might already be diagnosed with certain communication disorders, and the reason for assessment is not to determine a diagnosis, but the reason for assessment is to determine the strengths and weaknesses in certain areas. So in this instance, it's probably not necessary to give an entire language test, okay? Because I don't really need that full language score because I know they're already disordered. But the SLP might choose certain subtests from the different tests to make the ultimate test battery to assess as skills for that child. So we definitely do this in reading. I mean, we do it in a lot of the different higher level skills that we're looking at in school age. Okay, so now it is time to read the majority of this report that I have given you. Okay, so I want you to read it first. All right, just read it and get a good picture of of the flow and what we've looked at. Then I want you to kind of go back to be able to really kind of think about what you read. I want you to make a list of the norm reference assessments that we used and what skill did it assess, and then write down a list of the criterion reference assessments that were used. I will post this later on the answers to this, but first I didn't want you to have access to it. I want you to do it by yourself first. So later in the week, or maybe at the end of the week, I'll post this so you can kind of compare the answers and then what I put. And then for the sections on the language assessment, narrative assessment, and pragmatic and reading sections, I just want you to list a couple things that you feel like this client had difficulty with in each section. Okay, so I'm not going to probably really put that because or I might do a whole list, but that's just to help you kind of hone in on some of his deficits. But does he definitely have more than 2 areas of weakness in each of those areas? I can give you a little heads up that yes, he does. But I don't want this to be a long activity for you, but just enough to where you're kind of really critically kind of thinking about what you're reading. So, all right. So I really would like you to go ahead and do this activity now, okay? If you don't have time, then fine. Keep on going because we're going to shift focus just a little bit in the rest of the PowerPoint. So you can come back and do this portion later if you want, or you can stop and do it now. All right. So like I said, we are shifting focus. So in this next section, we're going to discuss assessments in specific disorders. So we're going to look at auditory processing disorders, specific learning disorders, language disorders, and intellectual disabilities, and then looking at the CLD or the culturally linguistically diverse populations. Okay, so remember that all of the discourse we're going to, I'm sorry, not discourse. My mind's on a certain path now, right? No, remember that all the disorders that we're about to discuss, the ones I just listed, all fall under specific learning disability. So in the assessment, we will see a pattern of strengths and weaknesses in the child. So do you remember with SLD, intelligence has to be within normal limits to have one of these learning disorders or disabilities. And we see deficits in one or more academic areas. So this is our first one. This first slide is just a reminder on what auditory processing disorders are. So it must include a deficit in the central auditory nervous system. Auditory processing and language processing, remember, are not the same. Auditory acuity and IQ are going to be within normal limits if they get this diagnosis. And then it should be diagnosed by a team, but remember that the audiology is the primary diagnostic factor, and they're the ones that will actually give the final diagnosis of APD if it's warranted. And then that child must be 7 years of age to get this diagnosis. Okay, so what are we going to assess? You've already heard it's a team assessment. So we're going to focus on auditory and listening skills. Your team at the very least is going to be your SLP and audiologist, but you're going to definitely gain information or get information from the teachers. You have to, and the parents. You have to, and then also the individual themselves. So some symptoms that we're going to look for in either the checklist from the teachers or while we're observing them is we're going to look for some repetition. We're going to look for them going, huh? So those questions for repeating. We're going to see them probably very distracted, and then difficulty following directions, and then often, I didn't write this on the slide, but seeing them, observing them just staying away from large groups of people. Okay, so this is kind of where I got that picture of that little kid. You know, if large groups of people makes the individual do that, like put their hands over their ears because it's just not a pleasant experience, that's definitely something we can observe. So differential diagnosis of APD is really difficult. So I want you to look at these symptoms, all right? Really, are any of these symptoms just specific to APD? Couldn't you look at these symptoms and maybe the etiology going to be a language disorder? Or how about ADHD? So the tasks on these next two slides that I'm going to talk about are imperative to differentially diagnose APD from other disorders that are going to have similar types of symptoms that we're going to observe. So first, we're going to talk about the audiologist's role. Of course, they're going to just make sure that that hearing acuity is within normal limits first. They're going to rule that out. So they're going to do pure tone testing, speech recognition testing, and admittance testing. And then we're going to get into more of our APD testing battery. So the audiologist is going to look at temporal processes, so that ability to detect changes in the duration of an auditory stimulus or the time intervals or gaps of silence within a stimulus. So this is an important skill for speech perception and noise. So the gaps help you hear or help the individual hear the speech signal. Then we're going to look at auditory filtering, and I'm going to show you some stimulus items that we give in the next slide off of the short sensory profile. So looking at what are their reactions when there's speech and noisy environments. Then spatial processing. So when speech is coming from different directions, how are they attending? And then interhemispheric transfer or dichotic testing. So this is going to look at the ears. And is there a dominance for one ear over the other? So is there a hemispheric dominance for language? And so that means that one side of one ear or side of the brain is going to process at a different rate than another. And so um, research or evidence on typical processors is that sometimes there is a more dominant ear, but it's not real significant. It often has to do with right-handedness or left-handedness. It correlates there with that. But what we see in people with APD is that there is often a big discrepancy in ears that process information more efficiently and quicker. Then we're going to go look at some more in this on the speech side. I mean, sometimes the audiologist can do some of these on this next slide, but then sometimes it's the SLPs. It just kind of determines on the setting or depends on the setting. Okay, but first, like I said, we're going to look at just some examples here of auditory filtering. I also gave you in some of our studies that Dr. Schaefer and I do, as well as when we're in clinic, we'll look at visual auditory sensitivity also. But here's the auditory filtering questions. Are they distracted or have trouble functioning if there is a lot of noise around? Do they appear not to hear what you have said? They can't work with background noise, has trouble completing tasks when the radio is on, doesn't respond when their name is called, but you know the child is hearing okay, and then has difficulty paying attention. So those are just a few tasks to look at the auditory filtering. Oh, I'm so sorry. I just realized I had not put those up yet. Okay, read over those for just a second. The SLP's role in the language assessment portion, so focusing on comprehension and working memory, okay? So the application of some of those skills within language, and then working memory has such a huge significance on auditory processing abilities. So we're often going to give the clinical evaluation of language fundamentals, but I'm not going to give the entire test. You're going to see this is a perfect example of a cross battery assessment, okay, that the SLP is going to do for auditory processing. So we're going to pick the different subtests from different norm reference tests, pull in some criterion reference assessments, and then to kind of assess those specific areas we want to look at. But concepts and following directions, that makes sense, right? So looking at language processing, but then also that's huge working memory. Recalling sentences is going to be processing of, the phonology system. Did they hear everything that was said correctly? But then, of course, working memory also. Understanding spoken paragraphs is so these are longer, short paragraphs of information in which they're going to have to they're going to have to process, determine what is salient information that they should probably remember, retain that information, and then access that information based on what the stimulus items are. And then digit repetition is just repeating back numbers forward and backwards usually. So the test of auditory processing skills, I'm going to go over those specific subtests here just on the next slide. And then the listening comprehension test is another good one, looks at main idea, what is their ability to determine and remember details, their reasoning ability, vocabulary, and understanding messages within the listening context. So here are the subtests of the test of auditory processing skills, or the TAPS. This is the APD test that I've used the most as an SLP. It's not perfect, and sometimes it really does look at those individual skills, and it correlates very nicely to a lot of the different tasks that the audiologist is looking at. And so these are more functional. And then I will say the listening test even looks at more functional type of skills. And this one kind of breaks it down. So word discrimination, can they discriminate between two words? Are they the same? Are they different? Phonological segmentation. And then phonological blending. So can I, if I say cowboy, then tell me what are the two words you hear? Or if I say, then you do it backwards, right? If I give you cow and I give you boy, what word did I say? And it's not always compound words like that. It might be certain sounds. That would be the breaking it down to the phoneme level. So numbers forward, numbers reversed, definitely memory, word memory, so giving them a list of words and having them repeat them back, giving them sentences to repeat of increasing in complex ability. Auditory comprehension is giving them a paragraph and having them answer questions based on that paragraph. And then auditory reasoning, excuse me, giving auditory information. Can they make inferences and pull information, more higher level information? I'm so sorry. So as you can see, it goes from easier to harder types of skills there. Okay, so now we're done with auditory processing, and we're going to look at specific language impairment. So of course, we're going to take that language or that conversation sample, and we're going to analyze it for the morpho-syntactic structures, the vocabulary, or maybe the mean length of utterance. So, this is where we are definitely probably going to elicit that conversation sample. We're going to analyze that sample or transcribe it, sorry, and then we're going to choose what analysis that we want to do based on what questions are we trying to answer, right? So we're going to have our norm reference tests that are going to give us some information, but then I am going to choose some analysis of different areas that are going to complement that norm referenced assessment results, and I can compare the more naturalistic abilities with the abilities I see on the norm reference tests. Okay, I'm going to look at conversation. I am going to look at how competent are they in that conversation. What is their ability to turn take? What is their ability to maintain a topic? How can they repair conversation? So do they have those different abilities? What are their pragmatic abilities within that conversation? Next, of course, we're going to look at narratives, and we're going to talk more about that next week and how we're going to assess that. Expository discourse is going to be looking at how we explain or describe a topic. So it does not primarily present contingent events or focus on a performance of action. So remember that it features information that is logically oriented around the themes. So they're going to use I'm going to look for third person forms that are being used or not used. I want texts that are oriented around a specific agent. I want to see parts of a problem, solution, Definitely supporting argumentation, and then evaluation of the solution. Okay, and so we're going to get more into that. I do want to say if they are at the age in which they're writing, we do want to look at the expository abilities in discourse, but then also in writing. We're going to look at those meta skills, their linguistic, their cognitive, their pragmatic meta skills. And, most of that's going to be through observation, right, in our conversation sample. And then, of course, we're going to look at their functional communication. That's often going to be done through checklists, by the teacher, by the parent, by the SLP, and just observing them in their classroom. Now for intellectual disabilities, so just remember children with severe disabilities may not be able to complete those norm referenced assessments, okay? They don't have the ability to be conditioned to the tasks, or um, they might not be at the cognitive age for the norm reference test that we usually do for so they're not the cognitive or the mental age for their chronological age. So I might choose to pick a test like maybe the preschool language scale. So maybe a 16-year-old with ID is functioning more intellectually at a 5-year-old level. So the PLS is a more appropriate test to give them. It's going to give me a better picture of what their strengths and weaknesses are in their language, but I cannot use the norms, right? I've broken standardization because they're too old for this test, but I have now turned it into a criterion referenced assessment, right? So it's going to tell me some nice strengths and weaknesses, but not norming it there. I'm definitely going to look at their functional communication profile. Again, lots of checklists by the teachers and the parents and the SLP, and how are they just functioning every day with what communication skills they do have. And then I do want to remind you, every child can be assessed, okay? It's just maybe not going to be that normal norm reference type of battery there. So it's probably going to be criterion reference. Now let's talk about ADHD. Reminder, the SLP does not diagnose ADHD, but we're going to have children who we are assessing for communication that have this disorder. So these are testing environment modifications that we often have to implement with these children. So they need a quiet testing environment with few visual stimuli. Um, Make them take frequent breaks. They might not say they need them, but make them take them. And then we might need to break that test over several sessions, over several days, instead of having them do, 2-3 hour sessions that maybe a neurotypical kid could do. And then the assessment report should be collaborative with the other professionals that are involved in their care, of course. Now we're going to have a few points about CLD, or culturally linguistically diverse, and our second language learners. If a student is a second language learner, we have to assess in both languages to determine that disability, okay? So if for some reason we are not able to do that second language evaluation, then we're going to report scores in English, but we are not going to diagnose, okay? We can't diagnose without diagnosing in their primary language. If we determine a dialectical difference, we have to refer to information regarding those specific dialect variations, okay? So lots of information and charts out there that we review and we refer to when when we see a dialectical difference. Okay, so we are now finished with the general assessment discussion of school-age children. So since it is a language disorders class and we're talking about school-age children, like I've already said, we're going to go into narratives next week in depth. I really enjoy narratives. To me, it's quite amazing to me the variability of these narratives so we can see and really the etiology of why they're breaking down. We've learned more about narrative abilities in different populations and what we expect to see and sometimes don't see. So it's such an important aspect of communication beginning in that school age. So I look forward to next week. I will see you then.